People who can lick their elbow, bend their joints backwards, and have extra stretchy skin often seem like they belong in a circus. However, these symptoms, along with joint hypermobility, joint pain, delayed wound healing, easy bruising, and easy scarring, are common to those with classic Ehlers-Danlos syndrome, otherwise known as EDS. EDS is a heterogeneous connective tissue disorder that is an inherited autosomal dominant genetic trait. We did this by placing ourselves in a location by starting with just joint injuries and adding a new symptom each week for 4 consecutive weeks. Group members experience the symptoms and anxiety increases caused by EDS. Group members were required to simulate symptoms common to those with EDS when there would be a high population of people. The location we chose was Meridian Mall, and more specifically, we traveled from Macy's, Abercrombie, and Dick's Sporting Goods inside the mall. Depending on the reactions we obtained from society's responses, we labeled them as positive or negative. A positive reaction was defined by people who offered to help or greeted the group members in the mall and who inquired about the disease with a genuine interest about learning about it, while negative reactions consisted of those such as staring, deliberately pointing or laughing, or making fun of a disabled group member. Each group member took private journals of their experiences throughout the progressive trials of the experiment. We hypothesized that through experiencing the time-consuming daily tasks of those with EDS, we would better understand how having EDS could completely modify one's daily life. We also hypothesized that the progressive nature of the sociological project would cause increasing levels of anxiety in group members due to an increasing amount of attention and negative responses from society. To track and record our anxiety scores through the progressive trials, we used the Zunk Self-Rating Anxiety Scale. We began the experiment by doing a control where we traveled from store to store in Meridian Mall, observing each group member's normal interaction with society. We walked through the mall for an hour while timing ourselves for 15 minutes in each store, as well as 15 minutes walking from store to store, how we normally would. We recorded the number of positive and negative responses we received during this time, and we used this number as the control of responses for the rest of our experiment. We also took an anxiety test after this trial to record our anxiety levels during a typical trial to the mall. For the second week of the experiment, we stimulated the easy joint dislocations associated with EDS by wearing a specific piece of medical equipment to help us with joint dislocations such as an arm brace, pair of crutches, a leg brace, and a single crutch. Positive and negative responses of society were recorded, journals were taken, and anxiety levels were measured for 2 separate 1-hour trials during this week. We immediately noticed a difference in the way society responded to us compared to our control trial. For the third week of testing, we added dark-colored makeup onto our faces to simulate the common acne scarring and bruises found in EDS, as well as still wearing our piece of medical equipment. For the fourth and final week of testing, members of the group wore t-shirts that said, "I have EDS," in addition to our bruises and scars and our piece of medical equipment. A few interviews were also taken during this week to exemplify how members of society perceived us. A worker from Dick's Sporting Goods was questioned by 2 group members about his reaction when one of the group members asked for a guard for her face because she wanted to play tennis but didn't want to take a chance of any more bruises or scarring on her face.
Honestly, when she asked for a helmet for tennis, it was a little bizarre because, I've played tennis for 6 years and I've never seen anybody with a mask or a helmet, so.
Yeah, I guess it's common for people with EDS. And you said you knew people with EDS.
Yeah, I know 2 people with EDS, and both of them they didn't play sports or anything.
The positive and negative responses recorded throughout the trials, as well as the anxiety scores measured using Zunk anxiety test after each trial, were totaled, and results were analyzed and compared using graphs made based upon the quantitative data. During the control trial, the group received a total of 82 positive responses in comparison with 20 negative responses from society. Group members' anxiety scores ranged from 23 to 28. As hypothesized, the overall number of positive responses from society decreased and the overall number of negative responses increased as symptoms were progressively added on throughout the trials. The anxiety levels in each group member also increased as the experiment progressed. By the final trial in week 4 of the experiment, the total number of positive responses toward group members had lingered down to a mere 26, while negative responses had increased to an overwhelming 109 total. Anxiety levels during this trial now range between 31 to 34 for all 4 group members. In conclusion, the way society reacts to those exhibiting EDS symptoms can lead to major frustrations, lower self-confidence levels, and increased anxiety levels. This experiment helped others become more aware about EDS, as well as provided a way to understand what a day in the life is like for those who struggle with EDS.